Welcome back. One of the first big names President-elect Donald Trump announced for his new administration was former presidential candidate Robert F. Kennedy Jr. He's got big plans for the Department of Health and Human Services. There could be a lot of change in that realm. Let's talk about that with former HHS official Jack Kalavritinos. He's here in studio to talk about that and much more on the show. Welcome back, my friend. Good to see you.
Thank you.
I appreciate it. This is something that you have quite a bit of experience in the realm of the HHS. Let's first of all talk about RFK Jr. What's your take on him as a pick here?
You know what? A lot of people weren't expecting it, and some people were speculating, would he be the chair of a MAHA commission or whatever? But I think more and more people are wrapping their heads around this. May be actually a genius choice. I mean, we have Dr. Oz, who people don't give him enough credit. He is a very substantial doctor with quite a background. Who is going to be FDA director, commissioner? You're going to end up with a lot of Senate confirmed people. And maybe, just maybe, what RFK will be focusing on is food additives and wellness and making the country healthier, not on the vaccine side, some of the things that have been maybe a little more controversial.
And that's a good point, because I think that's something that a lot of people have mentioned in terms of, it's a big thing. Food additives have been a major concern for a lot of people, a lot of parents, a lot of health-conscious individuals. That's legitimate. You mentioned the vaccine front, which, when you look at President Trump's first administration, Operation Warp Speed, which was a big success in terms of getting shots into arms, it wasn't necessarily popular with a lot of people who were skeptical of the vaccine. So how does RFK Jr., how does he get past some of the comments he's made about vaccines in the past and win people over on that front?
I'm going to tell you a little bit. I'm going to answer that by letting you know what I'm telling some of my clients. And I had a healthcare council meeting yesterday with a whole range of government affairs people. And this is what kind of the consensus was that once Operation Warp Speed, which really was maybe the #1 public health success in a short period of time in our history, 8 months that occurred. But what happened after that were mandates, was a level of, let's just say, people talked about misinformation, but the government didn't always talk about what it actually would do and its efficacy and what it wouldn't do. It wouldn't necessarily keep you from getting it. So I think a lot of people think that maybe it lays the groundwork for let the public know more about what are side effects, who are the people that most should get vaccines. Let's never do mandates again and have more of an adult conversation, to use a phrase that the Biden people used at the beginning of maybe have more of an adult conversation and let people make informed choices. And I think if he becomes a leader in that, if a Dr. McCary or anyone else becomes FDA commissioner and they talk about it, that moves you away from talking about childhood vaccines, which the vast majority of the American people are in favor of.
Yeah. As you look at where the role of HHS in previous administrations, obviously during the Obama years, it was about implementing the Affordable Care Act and getting those marketplaces up and running. During the first go-around with the Trump administration, COVID became a major concern in the latter part of those years. So, you know, you mentioned about making America healthy again. It is a broad term there. You know, is there going to be a health care mandate? President Trump has said in the past he was going to overturn the Affordable Care Act and do something that cost less that would be much more effective. Is there something to be done in that realm? They have the House and Senate now. They can do these things.
I'm so glad you're actually asking about HHS, because I've been coming on for the last couple of years, and you always put down on the chyron, you know, former HHS official. We don't actually talk about it. And people actually don't even know what it is often, because what it is the largest organization in America and one of the largest in the world. It's a $1.7 trillion entity. Often you have governors, you have former deputy secretaries running this huge thing with 15 different operating divisions. The FDA and Medicare and Medicaid and NIH, those are only 3 of the 15. So one area is on health insurance. There's not going to be a repeal and replace, but there are ways to get short-term insurance, or these things called association health plans, ways that people can have more choice in their insurance. Also, with opioid abuse, President Trump talked a lot about the border, but HHS is the place that can actually work with states to make it a #1 priority. And before COVID, at HHS, that was actually our #1 priority, going to your home state in Pennsylvania, Ohio and Kentucky, but all around the country. Since then, fentanyl's become, sadly, you know, the #1 topic as a terrible subset of the opioid crisis.
There have been some states that have had success with from outgrowth of the ACA, their own health exchanges, and some have expanded Medicare, and some, but it's been a state-by-state decision. Is that the way to make it work in this new administration, kind of deferring to the states?
I think you're going to find that, like Dr. Oz is going to end up with a head of Medicare under him and a head of Medicaid. And the last Trump administration was very willing to work with states in order to see what you're right, what their waiver requests are to do different and creative things. And I think that's part of like the Republican way is let's defer more to states and let's see what in the laboratories of democracy they come up with, and let's be more amenable to maybe saying yes to them as opposed to, no, there's something called Obamacare and we want to fit everyone's plans into that structure.
Yeah, well, we're going to keep our eyes on this one because there's a lot of change, and I know, Jack, you were talking with Tom Fitzgerald a couple weeks ago because you know about transitions when it comes to this sort of situation. We'll keep the conversation going. Jack, good to see you again. Thanks for coming in.
Great to be here.
Final Five is back after this.